When Indian Medical Association came to know about the Nepal disaster, they immediately came into action. A detailed plan of action was prepared, and all the office bearers, president and secretaries, and 1700 branches were sent do's and don'ts about earthquake. A monitoring cell was established at IMA headquarters. IMA branches were requested to volunteer their services financially as well as by way of volunteering to go to Nepal and help the Nepalese victims. A request was made to Indigo Airlines to provide free tickets to go to Kathmandu, and the same was accepted. A team of 13 doctors was sent to Nepal. All volunteered their services. The doctors came from Chhattisgarh, Gujarat, Maharashtra, and Punjab. When the medicines were collected worth 40 lakh Nepalese rupees, IMA did a flag off of the drugs at IMA headquarters. The flag off was done by past President Dr. Vinay Agarwal. Dr. Ashok Gupta, Dr. Kanchan Gupta, Dr. Shashank, Dr. Sujit, Dr. Kanani, Dr. Anup Verma, Dr. Deol, Dr. Dilip Sheth, along with few paramedicals attended the camp from 30th April to 9th May 2015. The first team was led by Padma Shri awardee Dr. Ashok Gupta. They met the Director, Ministry of Health, Populations, Government of Nepal. All the formalities were completed and permissions taken to work in Nepal. Dr. Ashok Gupta visited to the Tribhuvan University Teaching Hospital. The IMA team attended a OPD at distant medical relief site in Ranipur in association with Vayodha Hospital. In total, during the duration, the IMA team saw over 1500 patients. They got attached to many hospitals. They went to affected areas. They worked in tents. They did surgeries. In one of the gangrene patients, they were able to save amputation. The faculty also took lecture on reconstructive microsurgery for postgraduate students in Nepal. The IMA team also worked with other NGOs and other hospital doctors who were visiting Nepal for the relief work. Mr. Harsh Garg was our host from Heartcare Foundation of India. Along with his wife, Mrs. Namrata Garg, they were very gracious in making most of their arrangements with the help of the local DIG police and making sure that IMA contribution to the Nepal victims is smooth and visible. Indian Medical Association, along with Heartcare Foundation of India and Udyog Development Foundation, went to Nepal to deliver medicines worth 40 lakhs Nepalese rupees to Nepal Medical Association, which was led by Dr. Anjani Kumar Jha. At the Nepal airport, the office bearers of Nepal Medical Association welcomed and honored the IMA National President Dr. Marthanda Pillai and IMA Honorary Secretary General Dr. K.K. Agarwal. Along with that, there is Amitabh representing the Udyog Development Foundation and Dr. Chetan Patel, Chairman of Disaster Cell of Indian Medical Association. And we can also see the President of Nepal Medical Association and the Honorary Secretary of Nepal Medical Association. The day started with blessings of Lord Shiva at Pashupatinath Mandir. The IMA and Nepal Medical Association met Ranjit Ray, the Ambassador of India, and appraised him about the association and the MOU which IMA and NMA are going to sign about collaborative projects. The Ambassador to India, Ranjit Ray, gave assurance that all help will be given for this initiative. IMA and Nepal Medical Association jointly addressed a press conference which was very well attended and later on covered very well. You can see that this conference was arranged and addressed in a tent depicting the true nature of the disaster. Their own press club was also got affected and got broken. The press conference was attended by most of the newspapers and was addressed by IMA National President, Honorary Secretary General, along with Nepal Medical Association President.
IMA extend all medical help including medicine and treatment power.
जैसे ही हमें यहाँ पता लगा तो हम लोगों ने अपनी पूरी टीम यहाँ पे भेजी थी जिन्होंने 1000 पेशेंट भेजे, कुछ ऑपरेशंस किए और उसके बाद में हमें पता लगा कि यहाँ पे दवाइयों की ज़रूरत है तो 40 लाख की दवाइयाँ हम लोगों ने यहाँ पे भेजी.
We have come on a fact-finding mission and also a goodwill mission. We fully support what the Nepal Medical Association is doing in bringing relief.
जुन जिल्लामा अहिलेसम्म हामी गोर्खा, धादिङ, काभ्रे, नुवाकोट, सिन्धुपाल्चोक यो ठाउँमा हाम्रो टिम चामल, टेन्ट र औषधि लिएर हामी गइसकेका छौं. हिजो मात्र सिन्धुपाल्चोकमा
Indian Medical Association along with Nepal Medical Association met the Director General Health Sciences at his office, who is a public health expert, and IMA and Nepal Medical Association appraised him about our activities. Dr. S. Uprati was very supportive of this initiative.
Thank you, Indian Medical Association, for coming here in Nepal, and there are all kind of ways to support Nepalese when most of the Nepalis are not. We really appreciate the kind of support we have been doing and the kind of support we have been proposing. Thank you very much. Thank you.
IMA and Nepal Medical Association jointly met the Health Secretary, so Dr. Sheshtra, as well as the Health Minister of Nepal, Mr. Khaga Raj Adhikari. The Minister and the Health Secretary was appraised of IMA NMA initiative.
I would like to congratulate all the teams from Indian Medical Association and Nepal Medical Association. They are working generously, supposed to the injured patients and the aftermath situation in Nepal. So I would like to congratulate all of you.
Thank you. Thanks. IMA then visited most of the affected sites. One can see the broken buildings. One can also see buildings which are not in their normal position. Most of them are unstable buildings. Many of the buildings, the 5-floor building was converted into a 2-floor building, and rest 3 floors had gone below the ground. One observation which IMA saw, that there were different types of tents available for the Nepalese population. One was the tent made of the waterproof material, tarpaulin tents, which were not branded, but the one which was branded, most of them were Red Cross Society of China. If there are 40 tents in one place, the one which were visible from a distance and from the main road, they all belong to China with prominent branding of their name. Probably India failed at this juncture. India donated a large number of tent material, but none of them contained Indian branding. When we talked to many people in Nepal, they all talked about that whatever help is being done by China, because their help was visible with visible branding. We went to Bhaktapur, where there was a second largest camp. There were 1700 people, homeless people, who were living in 40 stands. We talked to one of their representatives, who said that the only country who has done a lot for them is China, because they are giving them not only tents but also food. But he also acknowledged that Chinese tents are only 10 out of 40.
ये बताओ, इंडिया से कोई हेल्प क्या मिला अभी तक आपको?
नहीं मिला, कुछ भी नहीं मिला। इंडिया से
टेंट भेजा, पैसा भेजा?
नहीं भेजा है, यहाँ कुछ भी नहीं भेजा है।
India has donated worth crores of rupees as well as over 5 lakh tents, but it looked they were not visible because they were straight away donated to the Nepal government, and there was no branding. Visibly, it looked like that the branding of China was most projected and reflected to the society. We at IMA feel that Jungle mein Mor Nacha sabne dekha. When you are doing a charity, it must also be reflected to the people. Whenever you send any material, it must have a branding of your country. We saw a different type of PTSD management, that is post-traumatic stress disorder management, where we saw the police people and the military people doing a culture program. Over 1700 children and older people, children and young people dancing and marrying together, trying to remove the PTSD stress. This was a wonderful attempt by the police and the military to take care of the PTSD disorders. We also saw that in the camp of 1700 people, a place where the Chinese government gave them the material to create food, and the food was prepared by the local homeless people for the community. We had a meeting with representatives of Nepal Medical Association, and we had, they are all executive members and all past presidents who participated in the meeting. Nepal Medical Association wanted a help from Indian Medical Association, that they have received medicines worth 40 lakhs which they will be distributing. But they were wondering if Indian Medical Association can also think of donating them a van, which IMA told them that the matter they will take it up to the IMA executive and decide, and if agreed, they will come out with the IMA Nepal Medical Association initiative, where IMA will donate a van and they will manage the van for camps for such types of disaster affected people. This is not the end, but the beginning of a mutual relationship between Indian Medical Association and Nepal Medical Association. Nepal Medical Association is linked with Indian Medical Association as it is an affiliated association with IMA. Both of them are also members of Confederation of Medical Associations of Asia and Oceania, that is CIMAO, and World Medical Association. IMA will also be sending its report both to CIMAO as well as World Medical Association. We request all our supporters, branches, president and secretaries to come forward and keep donating for this noble cause, as the end of disaster is not yet over. Nepal is still at risk for getting many more earthquakes in time to come. Please donate generously for this cause. We bring you greetings from our National President, Padma Shri Awardee, Dr. A. Marthanda Pillai, and myself, the Honorary Secretary General, Dr. K.K. Agarwal. Jai Hind, long live IMA, long live Heart Care Foundation of India. Long live Udyog Development Foundation.